I'd like to talk about the two things that make a strong medical malpractice case, because I think you can boil these down into these two things. One, a discrete act by the doctor that was wrong, clearly made the bad decision or clearly performed the wrong treatment. And two, life altering injuries. It's so easy for the defense to complicate the medicine. And if we are able to boil it down to the one thing the doctor did wrong, it resonates and it gives the jury just a clear understanding of what happened in order to side with us.
We talk to a lot of people who have terrible situations happen.
Right.
And, you feel for them. They might have lost a loved one. They might be severely disabled. And, something bad really happened. And they want answers. They think that certainly something went wrong with the medicine or else they wouldn't be in this situation. And so sometimes one of the difficult things we have to deal with is, unfortunately, bad outcomes don't always mean that there's malpractice. I can think of a case where we were contacted. Unfortunately, a woman in her 50s had a hysterectomy, which is a standard, generally safe procedure, and had an unfortunate complication during the procedure, lost a lot of blood, and died, a few days later. And just on the outset, you look at that and you say, well, that's not something that should happen, obviously. It's a hysterectomy, something that are performed all the time. And so something had to have gone wrong. Was the surgical technique something with the surgery itself that went wrong, and how does he describe it in the operative note? And then when you have a case like that and there's a lot of bleeding involved, one of the other aspects can be, how did they respond to massive blood loss? And did they do it, in a timely manner? Did they do it appropriately? Did they give the right products, and all that? We rely on them, and if they don't see something wrong, then you go to the next aspect of the case. You talk to an anesthesiologist.
So in that case, what expert, and I'm going to asking you to name names here, but like who did you talk to?
Yeah, started with, a couple OBGYNs, because the first one said, no, I don't really see anything that went wrong here. As far as the surgical technique, they can't point to anything that the surgeon did that was negligent. And again, they might not agree with everything the surgeon did during the procedure itself, but it's another thing to say that the surgeon was actually negligent. Did they take an approach that no reasonable surgeon would take? Did they make an incision that no one should do in this type of surgery, or did they not look for something preoperatively that every surgeon would do? Right. And so they look at that and they just say, unfortunately, he didn't do anything that I can point to that looks wrong.
Now, if I recall that case, the lady had a large number of fibroids, and that was something that we were looking in to see if there was a technique, or they didn't properly consider the large number of fibroids in performing the surgery. What did some OBGYNs that you had look at it have to say about that?
Yeah, and they looked at that aspect of it. We got prior records to let them see whether this was something that should have maybe made it a contraindication for surgery. And I think the ones we talked to agreed that it increased the risk of the procedure itself, but it wasn't negligent to perform this surgery, given that many women might have the same condition, and they were didn't take an unreasonable approach given these pre-existing issues.
Right. So they couldn't say that there was another technique or another way to perform the hysterectomy that would have been that they should have used for the procedure.
Yeah, and then so after that, we look at the post or what happened after the incident started. The bleeding starts, and then
right, because we had just had another case where somebody bled after the surgery, and there wasn't anything wrong with the surgery that caused the bleeding, but she bled to death, and the hospital didn't handle that properly, and we prevailed. Yeah. in that case. And so I knew you and I both thought that, okay, well, if we can't show bad surgical technique, we were hopeful that something went wrong in the way that they handled the bleed. This was they were a super, super nice family who lost their mom. And ultimately, after looking at the records and talking to a number of anesthesiologists as we were looking at the bleed, I mean, they were given blood products after blood products after blood products, and just her body couldn't get the bleeding. And there's only certain things that can do in order to get the bleeding under control, and they did everything that they should have done to try to get the bleeding under control, and she kept bleeding, and then her blood lost the ability to clot, and that ultimately what happened.
Unfortunately, that's what happened. And we just, we didn't have the act that we could point to say that this is where they went wrong, or
Right.
we could say something went wrong, but we couldn't say that anyone was in fact negligent to cause, what had happened. But we've also had, the alternative, and I'm sure you can tell a story about a time where we've initially thought maybe we didn't have a case, and turned out, through investigation, and found that we did.
Right. Yeah, we have a case that we recently resolved for a woman who suffered these horrific burns. She went into the emergency room. She was having pneumonia. She was having breathing problems. She went downhill quickly, and she went into cardiac arrest. And she was transferred to the ICU. And part of the protocols, if you go into cardiac arrest, in order to help preserve brain function, is you want to cool the body down, so you don't it helps prevent suffering a brain injury. And so the hospital did that after discharge, and after they used this device that places water on various parts of the body in order to cool, and then they use the same water. They increase the temperature to bring the patient back up to normal body temperature. And it looks like they did that, and discharged her to another facility. And when she got to that facility, her skin just started breaking down. The initial assessment was this was just something unfortunate that happened to her. The way you're supposed to warm on this machine is you just press a button, rewarm, and that will bring the body temperature up gradually to whatever setting per hour the machine is set at. 0.5 degrees Celsius is the max. This hospital was at 0.25 degrees Celsius. Well, instead of pressing rewarm, the nurse just raised the target temperature. So the machine thought it was supposed to bring her back up to normal body temperature as quickly as possible. So the water temperature, and then that's when we saw, wait a second, every hour she was exposed to 107.6 degree water, and being in the condition was vulnerable to skin injuries. And it goes back to the one thing, like that's a story that you can tell a jury, that a jury is going to understand. This is, instead of pressing this button, the nurse did this. It's very clear what the nurse did wrong.
And in that case, I mean, you mentioned that she came in with cardiac arrest, and she's got these vascular issues. I mean, how do we deal with the fact that she's got these other issues that they're using the device to try to save her life, and
Right.
She does end up living. So, one of the issues is the fact that she ends up with these terrible burns, but they've also saved her life. So, I mean, what are some of the ways that we navigate that?
Well, you're just honest with it, and it's part of the case. So in framing it and theming it, if one provider, and it was the doctor, the critical care doctor, who did everything right, and that doctor saved her life. But if the hospital, does everything right on one phase of their treatment, but makes a grave error on another phase, and that causes a horrific injury, is the provider that should we let the nurse completely off the hook just because the doctor did everything right?
Yeah, I think that's right. I mean, I think you make it clear that you have a doctor who did everything she could and did everything to save her life and was in fact heroic, in doing that. But there's also the issue that this should never happen. I mean, you can do both things. You can save her life and then not have these terrible burns. And I think, like you said, the most important thing is to not hide from that fact and to acknowledge it in front of the jury if it gets to that point. And I think they'll respect the fact that you're not, completely just going after the hospital that did save her life. You're acknowledging they did some things right, but unfortunately they missed on a pretty big thing.
The challenges I think that we have is we get invested in the case. We get invested in our clients. We'll get to know the family. We'll like the family, and we want to. We're here to help.
Yeah, I mean, obviously you talk to the client initially, and they're going to tell you a terrible story, and so you're invested, and you want to do everything you can to help them out. And like we were talking about earlier, we have to use experts. In Georgia, it's required that you have an expert that says that the provider was negligent. But, unfortunately, sometimes bad things just happen in medicine.
My client hired me to pursue their case, but they also hired me to get answers. I'm providing value to my client if the answer is the doctor did everything right, or the answer is, yeah, the doctor could have done B and C, but it was reasonable for the doctor to do what they did. That's an honest answer. And 99 times out of 100, the client appreciates that. And sometimes they have a sigh of relief. Well, okay, thank you. Now I can go to bed at night and knowing that there wouldn't have been a different outcome, and that the doctor wasn't negligent here, or didn't mess up. And so I try to see that as part of my role too. Is that we're here to give answers and to give closure. And closure isn't always a jury trial, and closure isn't always a big settlement. Sometimes closure is, the doctor did everything they should have, and this just unfortunately happened.